obviously going to have a way to pay for this. So this is what they'll do. The first part is the Medicare part. They will cut out the waste and the fraud. They're going to use the new information technology. Well, you know, it is there. Medicare, even though it has I'll wait.
Let her finish, please. That way we know, and then we can...
Ready? So the first thing that they'll do is those people who are under the top 2% in the country will not be paying for this. The top 2% will now pay an extra tax. And let me explain to you what the tax is. And let me also point out to you that the members of Congress who voted for this bill, every one of them already had health insurance, as you know. So they didn't do it for themselves. They had the health insurance. They also, many of them fell into the, I would say most of them, fell into this top 2%, and they basically taxed themselves to pay for this. So no matter how cynical you are about the rest of it, you have to at least acknowledge there that people tried to get a bill that would benefit middle-class America. Now, if you earn $200,000 as a single or $250,000 as a couple, then you will pay more on your Medicare, the hospital tax. It'll be 0.9% more. Also, on unearned income, if you are an individual earning $200,000 or a couple earning $250,000, then you will pay on your unearned income, and that will be a 3.8%. They'll also be finding the money through savings on Medicare Advantage. Now, most people in the state of New Hampshire have traditional Medicare, so they're not even in this equation. But Medicare Advantage is a program that they started because they said, well, maybe insurance companies, maybe private industry would be able to offer Medicare and save money and be able to do more. What happened was, instead of being able to offer it at a cheaper rate, they actually charged 14% more than traditional Medicare. And guess who they're charging? They're charging us. So the savings, that 14% that they're saving there, is going to be applied to do this. So there really is that savings there. And if you are on Medicare Advantage, and I think it's about 5% of the state of New Hampshire, you could see that that costs more. And other people have to pick that up. Now, the final part about saving money, and you know this is true, is that when somebody without insurance shows up at a hospital, then it drives the cost up for everybody. And you ask any hospital administrator, you ask anybody, anywhere about that, and they'll say yes, they have to pass the cost on to consumers. They have to pass it on to other people who have insurance. And we've had emergency rooms close around the country. There's been tremendous stress because people are uninsured and they still need access to medical care. So we will save money if they have insurance and they go, and then the cost is not passed on to the rest of us. So when you put that all together, Congressional Budget Office looked very intently at all of this. So again, this is not a perfect bill, but we got the train out of the station, and I do believe that we'll be tweaking it as we go along, just like you did Medicare and just like we did Social Security. But these are programs, and it really, I think, depends on what your philosophy is, whether you think that everybody should have and needs access to health care. If you believe that when people have health care, they will be healthier, and I believe that. If you look at seniors, you know that we've got the healthiest senior population ever. Why? Because they have a great government program called Medicare. And so by having Medicare, they are able to take care of themselves, which is a terrific gift for seniors. They've worked hard, they paid into it, and they are going to receive the same benefits. As a matter of fact, they'll be better than they were. And for others who do not have health care or have health care, but they know they could be dropped tomorrow by their employer or their insurance company could cut them out, this actually is a very consumer-friendly bill, now legislation. So having said that, I think this is probably a good stopping point and explain how we're going to do this with the drawing of the numbers. This is a very random way to get people and to be able to ask the question. Now, the way that we're doing this, when you came in, you got a number, and the other number was put into the bucket there, and somebody will draw the number. But We had a complaint because time before last, we allowed somebody to share a number, a husband and wife couple, and somebody didn't like that. And we also allowed somebody to defer the number and yield to someone, and they didn't like that. So considering that, I said, okay, we will, if you have the number, it's yours and nobody else's. Now, what you can do is you can spend 2 minutes. You can compliment me if you'd like. You can say, I don't like this at all, and give the reasons why. Or you can ask a question or any combination thereof. But when the bell goes off at 2 minutes, I would ask you please to stop. I'll answer, and then we'll allow somebody else to ask a question. And so I think that's the fairest system that we can come up with. So we're going to start right now by starting with the first number.